Coronavirus. Coronaviruses are a large family of viruses that can cause many illnesses, ranging from the common cold to more severe diseases. The most well-known of these is COVID-19, caused by a novel coronavirus, SARS-CoV-2. Here's what to know about COVID-19, including the disease's symptoms, transmission, severity, and treatments. What are the types of COVID tests and which one is the best? There are several types of COVID-19 tests, including viral and antibody tests. Viral tests, such as antigen and polymerase chain reaction PCR, diagnose active COVID infections. In contrast, antibody tests can tell whether you have antibodies, or proteins that fight off viruses. You develop antibodies after a previous COVID infection or vaccination. The Centers for Disease Control and Prevention (CDC) considers PCR tests the gold standard for COVID tests. PCR tests are highly sensitive, so they are the most accurate way to diagnose an active COVID infection. Given the various options, how do you know which test is right for you? Do they all work the same way and tell you the same information? Read on to learn about COVID tests, their use, and what they can tell you. Getting the right COVID-19 test. The right COVID test depends on your goal. The most common goal is to determine if you have an active infection. In that case, you'll need a viral test, such as an antigen or PCR test. In contrast, you'll need an antibody test to find out whether you have had a past infection. You might do point-of-care POC testing in a healthcare provider's office, urgent care center, or emergency room. POC testing is testing at the health site in order to get results sooner. These tests might be antigen or molecular, e.g., PCR tests. As with other antigen and molecular tests, there is a bit of a trade-off. Antigen test results are faster, which means these tests can detect COVID sooner and possibly prevent the spread of the virus. However, they aren't as sensitive at detecting the virus and might give false negatives, especially if you're asymptomatic, do not have symptoms. Molecular test results take longer, but these tests are more accurate at detecting the virus whether or not you have symptoms. If you receive negative results with an office or emergency room POC antigen test, do another at-home test 48 hours later, just as you would with a negative at-home antigen test. Test types for current COVID. Viral tests diagnose active COVID-19 infections. Polymerase chain reaction PCR and antigen tests are the most common viral tests. PCR testing, PCR COVID tests are the gold standard. 3 PCR tests are molecular tests. They work by detecting the genetic material of SARS-CoV-2, the virus that causes COVID. A healthcare provider will collect a sample, typically mucus or saliva, and send it to a lab for testing. Results can take up to about 3 days. PCR tests are highly sensitive, making them more reliable than antigen tests. PCR tests can detect SARS-CoV-2 from the earliest stages of COVID infection up to 3 months after you recover. You are likely not contagious if you test positive with a PCR test after you recover. Research has found that the virus can likely not replicate and spread about 9 days after symptom onset. Antigen testing. Antigen tests tell whether you have an active COVID infection. Antigen tests are useful for POC testing. In contrast to PCR tests, antigen tests have a quick turnaround time, usually within 30 minutes. Most at-home tests are antigen tests. At-home tests allow you to collect your own sample and get results within minutes. At-home tests might be easier to use and less intimidating than testing in healthcare settings. Antigen tests are less sensitive and more likely to deliver false negative results than PCR tests, especially if you don't have symptoms. You likely have COVID if you test positive with an antigen test. The CDC advises taking a second antigen test 48 hours after your first to confirm a negative result. If you have symptoms, you might need a third antigen test 48 hours after your second if you are asymptomatic. Sample types. You can provide different sample types for a COVID test, typically a blood or mucus sample. Your sample type might depend on the test. A healthcare provider will insert a needle into your arm to draw blood for an antibody. You might feel a sting when the healthcare provider inserts and removes the needle. Bruising or pain might occur after a blood sample, but those side effects usually go away quickly. Antigen tests usually require a nasal swab. You will also provide a nasal swab for a PCR test. A healthcare provider will typically take a nasal swab from the front or back of your nostrils or the uppermost part of your nose and throat. A nasal swab can be uncomfortable, causing you to cough or gag. A healthcare provider might ask you to take a nasal swab yourself. You will perform the nasal swab if you take an at-home test. When to test. Getting a COVID test at the right time ensures your results are as accurate as possible. The CDC advises testing right away if you have COVID symptoms. Remember that a singular negative antigen test cannot rule out an active infection. You might require repeat antigen testing or a PCR test to confirm a negative result. Testing for past infection, antibody tests, or serology tests, look for antibodies to SARS-CoV-2. Antibodies are proteins your immune system produces to fight off a foreign invader, such as a virus. An antibody test cannot diagnose active COVID-19 infection. Instead, your results can determine if you have had the virus. Antibody tests provide information on how many people have had COVID and the frequency of asymptomatic cases. Research has found that antibody tests have an accuracy rate of nearly 99.3%. 13. Your body might not produce antibodies until 1 to 3 weeks after infection. Therefore, an antibody test may not be accurate if you test too early. The presence of antibodies suggests that you previously had COVID or have been vaccinated. However, it cannot determine immunity from COVID after vaccination. The Food and Drug Administration has not authorized any at-home antibody tests. The Food and Drug Administration approved an antibody point-of-care test in September 2020 for healthcare providers to use. Antibody point-of-care tests can provide results within 15 minutes using a blood sample. Follow the CDC's instructions for testing if you have had COVID within the past 90 days. If it's been 30 days or less and you have symptoms, take an antigen test. Repeat negative tests if needed. If it's been 30 days or less and you do not have symptoms, the CDC does not advise testing. If it's been 3,190 days or less and you have symptoms, take an antigen test. Repeat negative tests if needed. If it's been 3,190 days or less and you do not have symptoms, take an antigen test. Repeat negative tests if needed. Where to find a test? You have a few options for a viral COVID-19 test, such as an antigen or PCR test. You'll need to receive an antibody test at a healthcare facility. Check the following places for a viral COVID test: a healthcare provider. Consult a healthcare provider if you are unsure what kind of COVID test is right for you. They might be able to give you a test in their office, online, or at a store. You can purchase at-home tests at your local pharmacy or grocery store, or order them online. Ensure that the Food and Drug Administration has approved any at-home test you are buying. Your local or state health department's website, you can find information on where to find a testing center that provides antigen or PCR testing.